We are living through a massive paradigm shift. Healthcare is moving beyond simple automation into the era of true agentic AI. Imagine patients understanding their symptoms through clinically grounded AI conversations, paving the way for immediate, accurate care. From reactive treatment to continuous wellness, where smart AI coaches personalize nutrition, sleep, and metabolic health every single day. In critical environments, AI transforms traditional ICUs into predictive command centers, tracking silent physiological shifts before they ever become emergencies. For our frontline heroes, doctors and nurses, AI steps in as the ultimate co-pilot, conquering administrative burnout and restoring the human touch to medicine. At Google, we are building the open ecosystem to make these intelligent workflows a reality. Let's explore the rise of agentic AI.
The biggest risk someone enters at this time of the day in such events is that everybody has talked everything, right? And it's very little that I can do. But I want to take a little different spin than what we've been talking since morning. I've been listening to all the speakers who have come before me, a lot of billion thoughts, a lot of billion areas that they covered. Now, what I want to talk about, I'm not going to talk about anything. AI is crazy, AI is great, AI is wonderful. No, I think that selling has already been done. What I want to talk about is how do we make it real? How do we transition from an innovation to a blueprint? That is what my next 10 minutes are about. It's about if we are looking at something, and I'm just borrowing what Mr. Dheeraj was talking about some time back, that can everybody create something out of it, right? I just showed you that example right away, what I did just maybe in the last one evening, right? So the important understanding that we need to take today is that can we take all this technology and all this information that we got today and think about converting into blueprints. What do I mean by a blueprint? A blueprint is something which is completely replicable. If there is a good innovation around reduction in ICU days happened in the CVD, there is nothing that stops within the endocrinology to look at it, what kind of similar biomarkers can be looked at, which we can use it, right? So that is what the blueprint is, that how do we use something repetitively. Now, I want to start with a paradox. While it may be, we may be privy to this, but this is very important to understand, right? If you look at the two contrasting stats that come up, right? And it's not that healthcare is devoid of innovation. It's because we want to be sure that what we are launching is in the right direction, right? And I'm borrowing something from our ex-CHO, that health moves at the speed of trust, right? So the data fragmentation is one of the biggest problems that we want to solve. And within this 85% staggering amount of data that you see, which is across various places, roughly 80% of this data is unstructured. What it means, we can talk enough about EHRs, we can talk enough about those system of records converting into system of engagements, but the real value is lurking somewhere else, which is those SOAP notes, those discharge summaries, those prescriptions, those diagnostic reports, everything which is unstructured. How do you bring it into mainstream? That is the blueprint of agentic AI talks about. Can we look at all these different functions and where we reduce any dependence of building lot of systems which used to take years and years, but use the power of agentic AI to drive and derive the right information from these systems for our usage, right? Second is, the biggest elephant in the room is the clinician burnout, right? And I think I don't want to delve further in the interest of time. We have spoken enough about it. And of course, the operational bottlenecks. So if you look at it, health is poised to innovate, but then we have those challenges staring in front of us, which is pulling us back. It's very important to understand how we have evolved. Traditionally, health has a very negative connotation. I don't think anybody will come and say, yeah, I want to get sick, right? So then if that is the case, why would someone, if you want to talk about, and by the way, I hate calling someone a patient, I want to use the word wellness users. Because the moment you use the word patient, it already has a negative connotation associated with it, right? So why do you want a wellness user to have a digital intervention with you? Unless we are somewhere dealing here. Now the entire essence is, how can we use some of these technologies and create blueprints which can help us move towards in that direction. So the precision medicine, which is the topic that we are dealing today, is not a straight line. It has some sort of in-between areas where you have to check across, which is about getting into the wellness management, right? Can we shift that connotation from a sick care to healthcare by focusing more on the wellness management? This is where I think there's a lot of focus, at least at Google, that we are trying to do. When we say that, can your point of care diagnostics, which is nothing but your lot of the variables that you wear, can they also become clinical grade in due course of time and become a source of a biomarker? So how do we tell before even you get sick that there is a chances of getting sick, and then of course moving on to the precision medicine. I've recently coined a framework which I'm sharing with you today. I call it an ad framework. See, we talk about it, all the innovations in isolation. The biggest challenge I see in the lack of any kind of a technology adoption in the right way is that the isolation that we see, right? And I believe that it has to be seen from all the three dimensions, which is the artificial intelligence, the data, the healthcare data which is powering it, and the healthcare domain which is associated with it. If I take out any one of this, what you're seeing on the slide, the blueprint ceases to exist. There is no health AI without data. There is no data on AI without the domain, right? So again, I don't want to preach to the choir, but all these blueprints are also deflecting or directing toward the same point that doctors are here going to stay for a very, very long time. So I think that's what the thing is all about. Now, if I were to just quickly go a level deeper into this, when we look at data, what is the data within the healthcare, right? You have data which is in your EHR and the clinical data. Then the new is wellness data, which is coming from a lot of the IoT, which is the connected care, connected homes kind of a concept. Your genomics and lifestyle data, remember the theme of the conference is again that how do we go toward the precision medicine. And then of course, quality and privacy, which are the guardrails, which to me is one of the most important aspects to be seen in a healthcare setup. May not be very, very important or on the front from any other domain, but from healthcare, this is non-negotiable because we deal with the protected health information data. Second, if we have that right matrix in place about your or data foundation, if I were to say, how do we make AI to work, right? To me, these are the three levers which are like super important. Can I use the data as I integrate through different sources to actually create predictive models which can be scaled and be created cross-department blueprints? Can it lead to precision diagnostics? And we talk about the personalized medicine, but the personalized medicine is something which is somewhere start from this direction, right? When you have a diagnostic which is very, very unique to me. We spoke about digital twin in the morning. Now these are the elements which leads to digital twins, right? Last is when you take all that into the agentic automation, where you take every workflow and integrate it together, sitting on top of the data and make it work together, you have a classic recipe of a blueprint. That means now you have quickly started reducing the amount of efforts a clinician or a nurse or a technician, phlebotomist is trying to pay, but you are surfacing the data at the right time, and the AI semi-autonomous or autonomous agents are doing that job for you. Now this leads to that most important aspect that I mentioned, that if I take the deep domain knowledge out of this equation, this entire premise cease to exist. So that crucial expertise, context, and ethical guardrails, where does it come from? It comes from the clinicians. It comes from the doctors. That is where all the elements that we've been discussing around the empathy, the very specificity about a case, the understanding of how one case is unique than the other, all that comes towards that, right? So it has to be seen as a cohesive ecosystem if our target is outcome. I love the way one of the speakers earlier in the morning said, it is about outcomes. Yes, it is all about outcomes. If all the effort that we are putting, all the innovation we are putting, if it is not reducing the clinician burnout or a healthcare professional burnout, or it is not helping a patient says that, yes, I feel more empathetic and more connected to the healthcare ecosystem, this is all waste, to be honest. How we have evolved? We have moved from a predictive to generative to now agentic. Why it is important to understand is that we don't have to take these entire steps together, right? Someone talked about it. We don't have a lot of legacy around EHR systems today. So it can be that a lot of the innovation that we can do may be devoid of even EHRs, wherever it is not done. But the key is to look at those unification elements that we talked about. Now, how does it impact the three personas? The wellness user, remember, we don't call patients, even if I can say that we can take one pledge that we call patients as wellness users, that itself is going to be a very big change. Second is the doctors, and third are the researchers. How are these personas impacted in terms of this, right? So from a wellness user perspective, you can bring in that remote monitoring, which is care at home, care wherever you are, to the hyper-personalized plans. Remember, now you have a data foundation which talks to each other. You have agents sitting on your data which are talking to each other. So now when you're talking about something about Manish or me, it is very specific to me, right? And of course, the virtual assistants. And it's essentially you are using the same technology for different kind of use case and scenarios. Next is the augmented intelligence. I call it clinical intelligence engines or clinical decision support systems, which are AI powered, which are there to help a doctor to either do a differential diagnosis or DDX faster, or can help him or her do a detailed diagnosis faster based on a lot of the understanding and different cases, which otherwise he or she would have taken a lot of time, right? And then, of course, it being an intelligent co-pilot with a doctor. Last but not the least, it's the researcher, which is also getting impacted. Remember, the precision medicine is a unification of the entire value chain. And from an autonomous drug discovery or clinical trial, population insights. So if you look at it, this has been visualized as a workflow of a blueprint, right? How each step can be impacted if we think it in the context of the ad framework that I talked about. Finally, right on time, I am just summarizing how it all comes together. You need to have that strong foundation of data which is integrated. You need to have that AI processing which talks to that data, because if otherwise it is garbage in, garbage out, if you don't have the right data foundation, which is leading to the clinical action, and the clinical action leads to the feedback loop. So it is like a circular approach where the feedback loop helps to deliver that. I will rest the case with this. I'm just also borrowing from the organizers, but I have added a word here called proactive. I want to make it actionable. Unless we make it actionable, unless each of the healthcare professionals sitting here makes it actionable, the other two will not become a reality. I thank you all, and this is what my presentation is all about.
Manish, I think it's a wonderful presentation. I'm in the industry. I work with the world's largest health company, and they've been talking about wellness for a number of years. And I really liked the way you put it, the proactive things. And I believe the most important thing that we all need to look at it is, what is the decision that will impact the patient care? I think if we can identify that important decision, and if you can apply artificial intelligence to that, I think that will really give us a better outcomes. That's my thought.
I think rightly put, and I think if you look at it, that is what my talk track was all about, that can AI be that augmented layer which helps you prioritize that? The biggest problem is in healthcare, we will never have enough professionals. We can't generate doctors overnight. It's a very, very busy and tough profession. So if I can help those doctors to make decisions faster, my job is done. If I help those patients, or not even patients, the wellness users as I want to call them, understand what they are going through or what their loved ones going through, most of the job is done. Rest is about getting our act together.
Manish, excellent lecture, and as I look at you, and as I look at the presentation what you are making, I want to give a different perspective.
Sure, sir.
See, if you look at the human history, it's all about business as usual versus change. Whatever it is all about that. Earlier, small kingdoms used to be there, then empire came, then after that, independence came. So, what is happening today in the modern world is, AI is trying to change the things. And it's heartening to see you in the thick of things, and you are going to shine in years to come as the brightest Indian. That is what I want to convey today and forecast this. Give him a standing ovation.
Thank you.
He's a wonderful person and wonderful work he's doing.
Thank you, sir. Thank you, sir. Means a lot. Thank you.